Why is insulin important? It activates a glucose transporter molecule in the intracellular space that allows glucose to pass through the cellular membrane into the cell. What occurs in IDDM? Pancreas produces no insulin that causes glucose to build up in the bloodstream and the cells turning to the breakdown of fatty acids for energy. What is NIDDM? Peripheral insulin resistance, where beta cells cannot produce enough insulin to meet the body's need. What is DKA? Where no insulin is produced causes the body to shift energy resources to fatty acids, which produce ketones that build up and cause metabolic acidosis. What are signs of DKA? Warm dry skin, polyuria, polydipsia, confusion, cusmules, vomiting, abdominal pain. What type of medication can an IDDM be treated with? Insulin and oral medications. What is the only hormone that decreases blood glucose levels? Insulin. What are two forms hormones come in? Amino acids and steroids. What is direct gene activation? Occurs with steroid hormones where they have an effect on a specific target organ and are freely movable into the cell due to the lipid layer. What is the second-degree messenger system? Occurs with amino acid hormones where they attach to the cell membrane that activates an enzyme that allows a protein channel to open and let the hormone into the cell. What is Addison's disease? Decrease in the production of cortisol. What are some causes that may exacerbate someone with Addison's disease? Hypoglycemia, fever, hypotension, GI symptoms, trauma. What is Cushing's syndrome? The overrelease of too much ACTH that causes an overproduction of cortisol. How much time would you have to get a patient to hospital on an M-tank at 600 pounds per square inch with a flow rate of 8 liters per minute? 19 and 5 seconds. What is secreted from the adrenal cortex? Aldosterone and cortisol. What are the 6 hormones secreted from the anterior pituitary gland? FSH, LH, TSH, ACTH, GH, prolactin. What are the 2 hormones secreted from the posterior pituitary gland? Vasopressin and oxytocin. Does the anterior pituitary gland produce the hormones? Yes. What does calcitonin do? Decreases blood calcium levels by deposition on bones. What does parathyroid hormone do? Increases blood calcium levels. Does the posterior pituitary gland produce the hormones? No, the hypothalamus does. The pituitary gland is only where they're stored. What is sulfur mustard? A yellow substance that can burn and blister the skin, causing burns, cough, eye irritation. What is lewisite? Concentrated mustard gas. What is the treatment for sore from mustard or lewisite? Flush with water and break blisters to get the chemical out. What is cyanide? A chemical that evaporates quickly and prevents the cells from using O2. What is phosgene? Is a colorless non-flammable gas that is a pulmonary toxic agent damaging the airways and lung tissue. What is the treatment for riot control agents? Off-gassing, irrigate the eyes with saline, possible Ventolin may be required. What is the pathophysiology of how nerve agents affect the body? Disrupts the enzyme acetylcholinesterase which is responsible for muscular and glandular control. What are 3 common nerve agents? Sarin, tauperin, soman. What are common signs of nerve agent toxicity? Salivation, lacrimation, urination, defecation, GI symptoms, emesis. What are some common signs that you would expect to see with someone who has overdosed on cholinergics? Mitosis, bronchial secretions, weakness, seizures. What is anthrax? A resistant and stable bacteria. What are routes of exposure of anthrax? Inhalation, ingestion, direct contact. What is ricin? A powerful cytotoxin. What are common signs of ricin poisoning? Severe vomiting and diarrhea with severe abdominal pain. What is thought to be the most devastating of all infectious diseases? Smallpox. What are common signs of smallpox? Fever, backaches, fatigue, small red lesions that become pus-filled. What is a simple asphyxiant? Displaces the available oxygen in the air. What are 2 examples of simple asphyxiants? Carbon dioxide and methane. What is a chemical asphyxiate? Interrupt that transport and use of oxygen at the tissue level. What are 2 examples of chemical asphyxiants? Hydrogen cyanide and carbon monoxide. What are examples of nerve poisons? Carbamates and organophosphates. What are examples of nephrotoxins? Carbon dioxide and lead. What are examples of cardiotoxins? Ethylene glycol. What does SCUPA stand for? Self-containing underwater breathing apparatus. What is barotrauma? Internal trauma to the body due to pressure and volume changes that can cause damage to tissues and organs. What is nitrogen narcosis? caused by breathing in compressed nitrogen, which is toxic to the CNS and causes confusion, slow motor response, and euphoria. What two laws can you apply to understanding decompression sickness? Boyle law and Henry law. What causes decompression sickness? Nitrogen bubbles flow into the tissues under high pressure and remain small in volume, and when pressure starts to decrease, the volume of the nitrogen bubbles increase in the tissues and can cause pain. Type 1 decompression sickness includes which body systems? Ear, sinus, skin, and the muscles and joints. What is type 1 decompression sickness? Caused by nitrogen bubbles collecting in the tissues and causing pruritus, molting skin, and skeletal muscle or joint pain. What is type 2 decompression sickness? More serious than type 1 and is caused by the gathering of nitrogen bubbles in the CNS, lungs, or heart. What is a mask squeeze in relation to diving? If a diver's mask is not equalized during descent, the relative negative pressure can produce petechial hemorrhages in the eyes. What is the chokes? Nitrogen bubbles collect in the pulmonary capillaries and cause a block, reducing oxygen delivery, causing sob, dry cough, and burning substernal chest pain worse on inspiration. What is the staggers? Audiovestibular DCS, causing issues with balance, partial deafness, vertigo, and nausea/vomiting. What is the law of conservation? Energy cannot be destroyed or created but simply change forms. What is the kinetic energy equation? Ke equal a half meter x v2. What does Newton's first law describe? An object that stays in motion, whether at rest or in motion, stays that way until acted upon by an outside force. What does Newton's second law describe? F equal mass x acceleration/deceleration. What are three separate impacts as energy is transferred in a motor vehicle collision? 1. The car strikes the object. 2. Person strikes the inside of the car. 3. Internal organs strike the inside of the body. What are two pathways that an occupant travels in relation to the dashboard? A down and under, B up and over. In relation to rear-end impacts in rear collisions, what produces the damage? The difference between the two speeds. In relation to rear-end impacts in forward collisions, what produces the damage? The sum of both car speeds. The aorta is frequently injured in deceleration injuries. Where is the aorta usually sheared from? Ligamentum arteriosum. What is Waddell's triad? The injury pattern observed when a child gets hit by a car. What injuries can you expect to see with Waddell's triad? Femur, chest, and head. In penetrating trauma, injury depends on crushing and stretching of the tissue, Injuries associated with vertical falls are a result of what two injury mechanisms? Deceleration and compression. What are three phases of trauma care? 1. Per incident, 2 incident, 3 post-incident. What would be considered a triage level green? Minor injuries and patient is usually ambulatory. What would be considered an triage level yellow? A burns without airway issues, B major/multiple bone or joint injuries, C back injuries without spinal cord damage. What would be considered an triage level red? A airway/breathing difficulties, B chest trauma, C serve bleed, D decreased mental status, E shock, F severe burns. Assessment of patient injury severity during an MCI is based on A. Abnormal physiological signs, B. Obvious anatomical injury, C. Concurrent disease factors. The MOI for basing spinal cord injuries are from positive, uncertain, negative. What are MOIs concurrent for positive spinal injury? A high-speed motor collision, B. Falls greater than 3 times heart height, C. Violence near the spinal cord. What are MOIs concurrent for uncertain spinal injury? A. Abnormal mental status, B. Distracting injuries, C. Intoxication. Where on the spine would axial loading occur? T12L2. What is the Emergency Operations Center? Heads of government agencies gather to coordinate their response to an emergency event. Incident Command Officer will base a direction to expand or contract the ICS organization based on what 3 incident priorities? 1. Life safety, 2. Incident stability, 3. Property conservation. What is a hangman's fracture? Due to hyperextension of the neck forces the C2 vertebrae. What is a chance fracture? Flexion and distracting injury of the spine when the anterior column fails under compression and posterior columns fail under tension. When does a chance fracture occur? When the body moves forward, suddenly fracturing vertebra. What is a common MOI seen with a chance fracture? Seatbelt injury. What is a common fracture seen in children? Green stick. What is a Coles fracture? Fracture of the distal radius with posterior displacement of the wrist and hand. What is a Smith's fracture? Fracture of the distal radius with frontal displacement of the wrist and hand. What is a boxer's fracture? Fracture to the 5th metacarpal. What nerve supplies stimulus to the diagram? Pharynx nerve. Le Fort fracture 3 is also called craniofacial dissociation. What is a Le Fort fracture 2? fractures starting from the nasal bridge and crossing down through the superior medial wall of the maxilla. What parts make up the cell? Cell membrane, nucleus, smooth endoplasmic reticulum, rough endoplasmic reticulum, Golgi apparatus, peroxisomes, mitochondrion, centrioles, lysosomes, cytoplasm. Transection of C3 and above on the spinal cord often results in respiratory arrest. Transection of C4 and above on the spinal cord often results in paralysis of the diaphragm. Lumbar nerve subepidermatome sensation to what part of the body? Lower body. Thoracic nerve supply dermatome sensation to what part of the body? Chest and abdominal. What is syncope? Transient loss of consciousness with loss of postural tone. What are 3 common causes of syncope? Vasovagal, postural, cardiac HX. What are less common causes of syncope? Urination, defecation, psychiatric. What is vasovagal syncope? The common faint caused when blood pressure drops to low. What is orthostatic hypotension syncope? The blood pressure drops in response to moving from a laying down position to an upright. What are 2 classifications of coma? Structural and metabolic. With a structural cause of a coma, what would you assume the pupils to look like? Asymmetrical and unresponsive. What are some causes of coma? Brain tumor, hypoglycemia, DKA, kidney failure, stroke, hypoxia, head injury. What is a tonic-clonic seizure? Seizure that affects the entire body, and starts with muscle stiffness, and turns into violent repeated muscle contractions. What is a partial seizure? Arise from identifiable cortical lesions. What is a complex partial seizure? Can cause the person to continue motor behavior without being able to remember, respond, or talk during the event. What is an absence seizure? Can cause a brief loss of consciousness without losing postural tone with isolated motor tics such as lip smacking or eye blinking. What is epilepsy? A neurological disorder caused by abnormal firing of electrical impulses within the neurons. What are some symptoms of a migraine? Throbbing headache with N/V, sensitivity to light or sound. The headache is usually worse on one side. Cluster headaches usually occur after what? After a person falls asleep. What are cluster headaches? A gathering of small headaches that occur in clusters over a period, and occur around the eye or temple. What makes up the cell membrane? A phospholipid bilayer made up of hydrophobic tails and hydrophilic heads. What is the nucleus? It is where DNA is found that contributes genetic information. What does the mitochondria control? Produces ATP when combined with oxygen. What is the rough endoplasmic reticulum do? Controls the production of protein synthesis due to ribosomes. What is the smooth endoplasmic reticulum do? Controls the detoxification of the cell from harmful substances. What does the Golgi apparatus do? Packages the proteins up and sends them to the correct locations in the cell. Peroxisomes complete what job inside the cell? Destroy free radicals/toxins. What is diffusion? Process where a high concentration of gas particles dissipates to an area of lower concentration. Explain hydrostatic pressure. Pressure that is created by a fluid. What is osmosis? The process where a solvent moves to an area of high solute concentration through a selectively permeable membrane. What is facilitated diffusion? A process where ions and chemicals are transported into the cell by protein transporters. What is oncotic pressure? Pressure caused by large proteins in the blood that act to control pressure on both sides of the membrane. What is active transport? A method cells use that require ATP energy to move substances into the cell against their concentration gradient. What are two forms of bulk transport? Endocytosis and exocytosis. What is cranial nerve 1? Olfactory, sense of smell. What is cranial nerve 2? Optic, controlled sense of vision. What is cranial nerve 3? Ocular motor, controls eye movement and pupil constriction. What is cranial nerve 4? Trochlear eye movement that rotates the eye up and down. What is cranial nerve 5? Trigeminal, carries sensory information of the face and activates mastication. What is cranial nerve 6? Abducens, controls the muscle that makes the eye look to the side. What is cranial nerve 7? Facial nerve activates muscles of the face to smile, frown, close our eyes and sensation of taste and salivary glands. What is cranial nerve 8? Auditory nerve, controls hearing and balance. What is cranial nerve 9? Glossopharyngeal nerve, carrying information from the back of the throat that allow us to swallow normally and controls blood pressure. What is cranial nerve 10? Vagus nerve controls muscles of the throat and travels down to the chest and gastrointestinal tract to stimulate bradycardia and increase gastric motility. What is cranial nerve 11? Accessory nerve controls muscles of the neck and back to shrug and turns the head. What is cranial nerve 12? Hypoglossal nerve controls the muscles that move the tongue. What is COPD? Chronic obstructive pulmonary disease where there is a V/Q mismatch. What is ARDS? Increased pulmonary capillary permeability due to infection or trauma to the lungs that causes pulmonary edema. What causes non-cardiogenic ARDS? Drowning, infection, cystic fibrosis. What is asthma? A condition that causes increased mucus production combined with bronchoconstriction and inflammation in response to an antigen. What is type 1 extrinsic asthma, and does it respond well to bronchodilators? Asthma that is caused by seasonal allergies, and has good response to bronchodilators. What is type 2 intrinsic asthma? Caused by a long-term exposure to irritants and causes more inflammation than type 1 extrinsic. What immune response mediator is most likely to trigger an anaphylactic reaction? IgE antibody. What is chronic bronchitis? Disorder that causes damage to the cilia and increases goblet cell production leading to formation of mucus plugs that causes increased dead space in the lungs. In terms of V/Q mismatch, what is an anatomical shunt? When blood does not perfuse the lung. In terms of V/Q mismatch, what is an physiological shunt? When blood is able to perfuse the lung but something is obstructing air entry to the lung and the lung has no ventilation while still maintaining perfusion. What causes chronic bronchitis? Irritants in the airway damage cilia and the airway lining causing inflammation. What is emphysema? Disorder that causes loss of elastin and destroys the pulmonary capillary bed that causes a loss of elasticity and increases air trapping. What is the normal ratio of V/Q? 0.80, roughly 4 liters of oxygen pass through the lungs each minute while 5 liters of blood passes through the lungs. Would a person standing upright have a natural high or low V/Q in the base of the lung, and why? Low V/Q mismatch that is natural due to gravity. Blood is circulated faster than the air taken into the lung. Would a person standing upright have a natural high or low V/Q in the apice of the lung, and why? High V/Q mismatch due to high air turbulence higher up in the lung but a decrease in blood circulation due to the pull of gravity. What kind of V/Q mismatch would chronic bronchitis be? Low V/Q mismatch, decrease in ventilation compared to perfusion due to the body trying to compensate by increasing the heart rate and decreasing ventilation. What normally triggers people to breath? The levels of CO2 in the blood. What is the hypoxic drive to breath in COPD-PTS? People with COPD are triggered to breathe faster and deeper when chemoreceptors sense low arterial oxygen levels, but when changes are made to increase ventilation and increase arterial blood oxygen levels, the person can no longer breathe deep or fast. How can a chronic bronchitis patient develop cor pulmonale? The disease leads to chronic high CO2 levels in the blood, which trigger pulmonary vasoconstriction, which puts extra pressure on the right side of the heart to work. What is normal adult's tidal volume? 500 milliliters. Describe Boyle's law. When pressure in a gas increases, volume decreases, and vice versa at a constant temperature. Describe Dalton's law. Atmospheric gases related to the sum of all partial pressures. Describe Charles' law. When volume increases, temperature increases, and when volume decreases, temperature also decreases. Vital capacity. Vital capacity is the maximum amount of air a person can expel from the lungs after a maximum inhalation. What is functional residual capacity? The volume in the lungs at the end expiratory position. What are signs of the blue bloater? Cyanosis, obese, productive cough, wheezing. What are signs of the pink puffer? Accessory muscle use, hypertrophied accessory muscles, thin, pursed lip breathing. What is the sequence of events leading to infant respiratory distress syndrome? Respiratory acidosis, hypoxemia, hypercapnia. What makes up Banks triad? Narrowing pulse pressure, JVD, heart murmur. If someone has signs of Banks triad, what is most likely occurring? Cardiac tamponade. What is Parkinson's? A motor disease caused by decreasing levels of dopamine-producing cells in the substantia nigra part of the brain. What are common symptoms of Parkinson's? Bradykinesia, trembling, impaired balance, stiffness in the limbs. What is myasthenia gravis and what causes the disease? And chronic autoimmune neuromuscular disorder that causes weakness in the skeletal muscles caused by defect in nerve impulses at the neuromuscular junction. The body attacks the receptors for acetylcholine. What is amyotrophic lateral sclerosis? A fatal neurological disease that causes the skeletal neurons to waste away and die, and the brain can no longer send messages to skeletal muscles. What is Huntington's disease? A disease that causes death of brain cells and the person loses the ability to be able to complete daily tasks, and eventually lose ability to talk or walk. What is osteomyelitis? Is an acute or chronic bone infection where the bone becomes infected with a bacteria or fungus and the bone forms an abscess which hinders blood supply. What are 4 signs of osteomyelitis? Pain around the infected area, local swelling and redness, possible drainage of pus through the skin, fever. What is osteoarthritis? Is a condition that affects the joint cartilage where bony overgrowth or excess fluid accumulation causes swelling and pain during movement. What is rheumatoid arthritis? An autoimmune disease that causes chronic inflammation of the joints, tissue, and other organs of the body. What is HIV? A virus that attacks the immune system and causes an immunodeficiency. What does HIV positive mean? When your body has started producing HIV antibodies specifically to fight against the HIV virus. What does AIDS stand for? Acquired immune deficiency syndrome. Can you get AIDS from another person? No. AIDS occurs after the fact your body can no longer fight off infection due to HIV. What is AIDS? When the HIV has severely damaged your immune system or you get an opportunistic infection. What is hepatitis A? An infection that is caused by a virus that causes inflammation of the liver. What causes hepatitis A? Fecal matter of an infected person. What causes hepatitis B and C? Blood and body fluid of an infected person. What are common symptoms of hepatitis? Fever, fatigue, abdominal pain, vomiting, diarrhea, jaundice. What two ways does pneumonia infect the lungs? Lobar affects the lobe of the lung where bronchial affects patches throughout both lungs. What are some common signs of pneumonia? Fever, coughing up rusty/green mucus, severe chest pain, tachycardia, tachypnea, stenosis. What is the Epstein-Barr virus? The most common virus that is a member of the herpes family. What is rubella? Is a mild illness caused by a virus that is also known as the German measles. What are 4 common signs of rubella? Rash, joint pain, sore throat, low fever. What is rubella? Is an acute highly contagious viral disease that is more severe than rubella, and caused by a different virus. What are symptoms of rubella? Starts with a fever, and then progresses to conjunctivitis, coryza, cough, and complex spots on the buccal mucosa. What is mumps? A virus-causing disease that spreads through saliva or indirect contact and infects many parts of the body. What is a major sign of mumps? Swelling and pain in the parotid saliva glands. What are common symptoms of mumps? Fever, anorexia, headache, swelling of the parotid gland or orchitis in males. What family of viruses cause the chicken pox? Varicella zoster virus, part of the herpes family. What are common symptoms of chickenpox? Itchy rash that starts on the back, face, and abdomen then spreads everywhere, fatigue, low fever, anorexia, headache. What is pertussis? Infection of the respiratory tract caused by bacteria that release toxins that prevent the respiratory tract from eliminating germs. What are common symptoms of pertussis? First starts with fever, dry coughing, sneezing, red watery eyes, then within a 2-week period dry cough becomes wet and brings up thick stringy mucus. What is a very common sign of pertussis that gave it its other name? Whooping cough. How is syphilis transmitted? Though direct contact with the sore. What is stage 1 of syphilis? The person has a painless sore. What is the second stage of syphilis? The person develops a non-itchy rash, fever, hair loss, weight loss, and fatigue. What is the final stage of syphilis? The person suffers internal damage which can include blindness, slow motor response, paralysis, and dementia. What are signs of gonorrhea? Burning during urination, pus from penis or vagina, orchitis, anal itching, burning or bleeding. Is chlamydia serious in women? Yes, the bacteria can infect the cervix and fallopian tubes, causing infertility. Herpes simplex type 1 usually causes fever, blisters around the mouth. Herpes simplex type 2 usually causes genital blisters. What are signs of chlamydia? Lower abdominal pain, fever, bleeding between menstrual cycles in women, back pain, vaginal/penile discharge. What are the receptors for the sympathetic nervous system? Beta 1, beta 2, alpha 1, alpha 2. What are the receptors for the parasympathetic nervous system? Muscarinic and nicotinic cholinergic receptors. Beta 1 is located where and has what effects? Located in the heart and increase the rate, contraction force, and conduction speed. Beta 2 is located where and has what effects? Located in the bronchioles and smooth muscles. Alpha 1 is located where and has what effects? Located on the blood vessels, it causes constriction when stimulated. Alpha 2 is located where and has what effects? Located on the presynaptic neuron, it inhibits the release of norepinephrine when stimulated. What is drug bioavailability relating to? The amount of drug concentration that actually reaches the target organs. What is the definition of half-life relating to drugs? The amount of time required to reduce the drug's concentration by 50%. What is the loading dose? The initial dose is greater than subsequent doses to achieve a maximal effect. After a non-competitive drug has bound to its receptor, subsequent administration of an agonist drug is unlikely to reverse the block. True. Dramatic decrease in systemic availability of a drug following oral administration is most likely due to first-pass effect by the liver. Antipsychotics typically reduce what brain neurotransmitter? Dopamine. What are cardiac physiological effects associated with the action of digoxin? Increases the force developed during myocardial muscle fiber shortening at a given preload for a normal individual. Principal alkaloid in opium. Morphine. Useful drug for opioid detoxification and maintenance of chronic relapsing heroin addict. Methadone and levomethyl acetate. Signs and symptoms of acute opioid withdrawal. Yawning, lacrimation, hyperventilation, diarrhea. Mechanism of action, diltiazem. Blockade of calcium channels. What is the difference between pharmacokinetics versus pharmacodynamics? Pharmacokinetics is what the body does to the drug, where pharmacodynamics is the action of the drug on the body. Blockade of this receptor system most likely associated with akathisia, side effect of antipsychotic treatment. Dopamine. Name 3 common alpha-adrenergic agonists. Epinephrine, norepinephrine, dopamine. What is a common selective beta-1 adrenergic agonist used for the treatment of cardiogenic shock or heart failure? Dobutamine. What is a common selective beta-2 adrenergic agonist? Salbutamol and terbutaline. What are beta blockers used for? Used to treat hypertension, arrhythmias, angina, CHF, glaucoma. What is the difference between selective and non-selective when it comes to drugs? Selective means it has effects only seen on a certain receptor, where non-selective means it has effects on more than one receptor. What are 3 common selective beta-1 blockers? Metoprolol, atenolol, bisoprolol. What are 2 common non-selective beta-2 blockers? Timolol and propanolol. What is nitroglycerin, and what is it used to treat? A vasodilator of vessels in the body that reduces cardiac preload and afterload, and mainly used to treat angina. Why is nitro good for angina? It decreases the heart's demand of oxygen by vasodilating peripheral vessels, and decreasing preload, as well as increase the supply of oxygen getting through the narrow coronary artery to the heart muscle. What are alpha-1 antagonists used to treat for? Hypertension, CHF, erectile dysfunction. What are common alpha-1 selective antagonists? Alfuzosin, doxazosin, prazosin, tamsulosin, terazosin, silodosin. What are 4 common drug class for antidepressants? monoamine oxidase inhibitors, selective serotonin reuptake inhibitors, tricyclics, selective serotonin norepinephrine reuptake inhibitors. What are 3 common tricyclics? Impramine, amitriptyline, nortriptyline. What are 3 common SSRI? Citalopram, fluoxetine, pyroxetine. What is discontinuation syndrome? Occurs when a person has a sudden discontinuation of an antidepressant that causes flu-like symptoms, sleep disturbance, and sensory disturbance. What is serotonin syndrome? When 2 or more serotonin medications are used together, that increases the serotonin level in the brain beyond the therapeutic threshold. What symptoms are associated with serotonin syndrome? Hallucinations, tachycardia, muscle contraction and agitation, hyperthermia caused by overactive muscle contraction, dilated pupils. What can antidepressants also be taken for besides mental illness? Fibromyalgia and neuropathic pain. What are some common antipsychotic drugs? Chlorpromazine, haloperidol, olanzapine, risperidone. What is a common name for second-generation antipsychotic drugs? Atypical antipsychotic. What are 2 common anticoagulants? Warfarin and heparin. How does aspirin work? Works by inhibiting enzyme COX-1 and 2, reducing inflammation, pain, fever, and is also an antithrombotic as it inhibits thromboxane A2, which is needed for platelet agglutination. What is a PT/INR test, and what does it test for? It is a regular blood test that tests the levels of prothrombin to make sure the levels are at the therapeutic level for people on anticoagulant therapy. Why should children not take aspirin? Reye syndrome that can cause brain inflammation. What are prostaglandins? Prostaglandins are local hormones produced in the body, have diverse effects, including the transmission of pain information to the brain, modulation of the hypothalamic thermostat, and inflammation. How does Tylenol work? Inhibits prostaglandin synthesis in the CNS only, reducing fever and pain. What are common opioids? Fentanyl, hydromorphone, diluted, morphine, heroin, oxycodone. What are common side effects of opioids? Sedation, constipation, nausea, vomiting. What are classic opioid overdose signs? Pinpoint pupils, respiratory depression, bradycardia, hypotension. How does an opioid affect the brain? The drug binds to specific opioid receptors in the brain and triggers an agonist reaction. What are naturally occurring opioid peptides in the body? Endorphins and enkephalins. What are diuretics used to treat for? CHF, hypertension, cerebral edema, renal failure. What are common classes of diuretics? Loop, thiazide, potassium-sparing, osmotic. What is a common loop diuretic? Furosemide. What are common thiazide diuretics? Bendroflumethiazide and hydrochlorothiazide. What is a common osmotic diuretic? Mannitol. What is the mechanism of action of loop diuretics? Inhibits sodium and potassium reabsorption at the thick ascending limb of Henle. What is the mechanism of action of thiazide diuretics? Inhibits reabsorption of sodium chloride at the distal convoluted tubule. What is the mechanism of action of the potassium-sparing diuretic drug spironolactone? Inhibits aldosterone action. What are signs of digitalis toxicity? Vomiting, seizures, heart arrhythmia, seeing halos around objects, dilated pupils. What % oxygen does a patient receive from a BVM? 90 to 100%. What is a junctional rhythm, and is it dangerous? When the P waves don't appear or are inverted. It is considered a dangerous rhythm due to arrhythmia and possible low cardiac output. What is Immobitz type 1? The AV node is partially blocked. The AV node will let impulses through but then completely block an impulse getting to the ventricles causes a drop beat. What is Immobitz type 2? The AV node is blocked and the heart rate's low and the AV node will only allow an impulse to go through some of the time. This causes more P waves than QRS complexes. What is heart block type 3? The AV node is blocked completely and the electrical activity differs from the atria to the ventricles causing multiple P waves that don't match wide QRS complexes and the rhythm is slow. Why does sinus arrhythmia occur in young adults and children? Increasing intrathoracic pressure increases vagal tone resulting in a brief time where the heart beats slower but then when decreasing intrathoracic pressure occurs it restores vagal tone, and then the heart rate increases again. Why are ventricular rhythms the most serious? The heart is less effective and the heart is functional on its last backup support. Hypoglycemia can result from alcohol, physical exertion, decreased food intake, insulin overdose, in diabetic patients with infection or unusual exercise. What are signs of hyperthyroidism? Heat intolerance, increased energy, anxiety, diarrhea, weight loss. What are signs of hypothyroidism? Cold intolerance, constipation, cold skin, depression, weak heartbeat. What is Graves' disease? Autoimmune disorder where the thyroid gland overproduces thyroid hormone. What are 3 major signs of Graves' disease? Bulging eyes, heat intolerance, increased energy. What effects on the body does cortisol produce? Increases synthesis of new glucose, protein breakdown, increased sensitivity of blood vessels to catecholamines. Cushing's syndrome is caused by what? A tumor on the pituitary gland overproduces ACTH, which overproduces cortisol. B. Small growth on the adrenal gland stimulates cortisol overproduction. What are symptoms of Cushing's syndrome? Obese trunk, muscle wasting, moon-shaped face, purple striations on the trunk, hyperglycemia, skin is thin and bruises easy. Where are stretch receptors located in the lungs? What do they do? Smooth muscle layer in control stretch within the lung becomes inflated and the receptors signal the need for expiration. What are irritant receptors located in the lungs do? Within the epithelial cells, these cells become stimulated to cause bronchial constriction when they sense nitrogenous substances like smoke, cold air, dust. What causes Addison's crisis? An stressful event that requires high cortisol levels like illness or trauma, but the body is unable to raise cortisol levels, leading to the crisis. What signs would you expect someone experiencing Addison's crisis to display? Sudden severe back or lower abdominal pain, vomiting, hypotension, dehydration. What is nociception? A physiological sensory input that stimulates an impulse through the spinal nerves to the brain. Where are nociceptors more concentrated? Fingers and toes. What substance releases chemicals at your spinal cord that increase the pain? Prostaglandins. What is the gate control theory when it comes to pain? When pain impulses meet up at the spinal cord, the gateway cells can filter out weak responses to pain while opening the gate for strong pain impulses so they reach the brain. Pain that is described as cramping or gas-like pain that varies in intensity and is diffuse and difficult to locate is what kind of pain? Visceral. Pain that is described as sharp and consent and is easy to localize is what kind of pain? Somatic. What is allodynia? Chronic pain that intensifies out of proportion to the original injury because the nervous system distorts the pain. What are some major signs of a UTI? Burning while urinating, hemorrhea, fever, back pain, pelvic pain, oliguria. What is the most common cause of a UTI? E. coli. What are signs of pyelonephritis? Fever, flank pain, vomiting, chills. What are common signs of renal colic? Sudden severe flank pain, hematuria, nausea, vomiting. Patients tend to move around consistently to be more comfortable. What are common signs of a penile fracture? Severe pain, ecchymosis, hematoma, and abnormally curved, often in an S shape. What are signs of testicular torsion? Sudden pain in the scrotal area, nausea, vomiting, swelling in the scrotum. Testicular torsion occurs because a blunt trauma. B. Strenuous physical activity. Kidney failure can cause what other diseases? Hyperkalemia, acidosis, hypertension, pericarditis. What are 3 pathophysiological causes of acute renal failure? A prerenal cause due to severe drop in blood pressure. B. Intrarenal cause due to direct trauma or kidney infection or drug/toxic buildup. C. Postrenal cause due to obstruction of urine flow because of trauma, tumor, or enlarged prostate. What are actual causes of ARF? Rhabdomyolysis caused from crush injury or seizures, pyelonephritis, placenta abruptio. Chronic renal failure may be caused by diabetes, hypertension, prolonged pyelonephritis. What are some dialysis emergencies? Hypotension, severe hyperkalemia, hemorrhage, air embolism. What protein is found in the serum levels of people who have had an MI? Troponin TNI. What best describes CBG? Heart surgery that is used to bypass around a blocked coronary artery to restore blood supply to the heart muscle. A paramedic should patch to base hospital when? The elements required for consent to treatment are: 1. Consent must be given by a person who is capable of giving consent. 2. Consent must relate to treatment. 3. Consent must be informed. 4. Consent must be voluntary. 5. Consent must not be through misrepresentation/fraud. Consent to treatment is informed if, before it is given to the person, he or she has 1. Nature of such treatment. 2. Benefits of treatment. 3. Risks of treatment. 4. Side effects of treatment. 5. Alternative courses of action. 6. Likely consequences of not having the treatment. A base hospital program is a program operated by a base hospital for the purpose of a delegating controlled medical acts. B. Providing per-hospital advice relating to patient care and transportation. C. Providing questions and answers relating to per-hospital care. D. Providing continuing medical education. What are the 5 questions that must be answered when investigating a death? A. Who is the deceased? B. By what means did the death occur? C. Where did the death occur? D. When did the death occur? E. How did the death occur? According to the duty to give information, every person who has reason to believe that the deceased died due to shall notify police or the coroner. A. Violence, misadventure, negligence, malpractice, or misconduct. B. Unfair means. C. During pregnancy or following. D. Sudden and unexpected. E. From disease/sickness for which the person was not treated by a doctor. What are the investigating powers of the coroner? A. Can view or take possession of the dead body. B. Inspect the place a body is/with. C. Seize anything the coroner deems material to the investigation. D. Authorize a legally qualified person to act on the coroner's behalf for the purpose for providing palliative care measures. What are paramedics allowed to give to palliative patients with a confirmed DNR? 1. Oxygen. 2. Glucagon. 3. Epinephrine. 4. Anaphylaxis. 4. Suctioning. 5. ASA. 6. Morphine. 7. Nitro. 8. Salbutamol. 9. Benzodiazepines. What are common signs of a rib fracture? Sob, pain when coughing or breathing, gagging, swallow breathing, Point tenderness. What are common signs for a flail chest? Severe sob, bruising, crepitus, accessory muscle use, swallow breathing, shock, paradoxical chest movement. What are signs of a simple pneumothorax? Sob, sharp chest pain worse on inspiration, low SpO2, tachycardia, absent breath sounds on affected side. What are signs of an open pneumothorax? Sob, low SpO2, open chest wound, absent breath sounds on affected side. What is a hemothorax? Blood fills into the pleural space. What are signs of a hemothorax? Sob, low blood pressure, tachycardia, chest pain, restlessness, pink frothy septum. What are signs of traumatic asphyxia? Severe sob, bloodshot eyes, swollen tongue, stenosis, distended neck veins. What is pericardial tamponade? When blood fills the pericardial sac and reduces the heart's ability to pump. What are signs of pericardial tamponade? Hypotension, tachypnea, tachycardia, JVD, weak pulse. Using the rule of nines, what is the percentage of an adult leg? 18%. Using the rule of nines, what is the percentage of an adult back? 18%. Using the rule of nines, what is the percentage of an adult arm? 9%.